Hello, I'm Dr. Abdul-Aziz Youssef. Welcome to today's lecture on our hospital policies and procedures for credentialing and privileging process. We'll examine key aspects through practical case-based scenarios. Scenario number 1. A pediatrician is applying for accreditation at a hospital. He has submitted his CV, training certificates, and a copy of their identity document. They are unsure if any additional documents are required. Which of the following must they also submit for the accreditation process? A. Evidence of participation in community service. B. A letter of recommendation from a non-medical professional. C. Proof of fluency in multiple languages. D. Valid pediatric advanced life support certification. Correct answer D. For a pediatrician, submitting certification in pediatric advanced life support is essential, as outlined in the accreditation procedures. This certification demonstrates competence in handling pediatric emergencies, crucial for the pediatrician's role. The accreditation process ensures medical staff are adequately trained and qualified for their specific roles, maintaining high standards of patient care and safety. Scenario number 2. An emergency medicine physician is in the process of credential verification. They have provided their educational background and work experience details. What additional step is crucial in this phase to complete their credential verification? A. Submitting a personal statement of intent. B. Verification of their medical license and training. C. A written examination in emergency medicine. D. Proof of residency in the hospital's local area. Correct answer D. Credential verification for an emergency medicine physician must include verification of their current medical license and training. Verifying these credentials ensures legal and professional qualifications to practice medicine, especially important in emergency medicine. This process protects patient interests by ensuring competent and qualified medical professionals. Scenario number 3. An orthopedic surgeon has provided references from colleagues in their application. The hospital wants to verify these references. Besides direct contact, which other method can be used for this verification? A. Checking public patient reviews. B. Verification through a website. C. A survey of their previous patients. D. Assessment of their social media profiles. Correct answer B. In verifying the orthopedic surgeon's references, the hospital can use methods such as verification through a website. This involves checking professional profiles, publications, or affiliations listed online, confirming the authenticity of the references and their professional standing. It's a crucial part of ensuring the credibility of the references. Scenario number 4. A neurologist has applied for accreditation, but the hospital has not received their primary reference documents after 2 requests. What is the next step in this situation? A. The application process is paused until the documents are received. B. A neurologist must provide a written explanation for the missing documents. C. The neurologist is responsible for obtaining the documents through a secondary source. D. The hospital will proceed without the documents. Correct answer C. If primary reference documents are not received after 2 requests, the responsibility falls on the applicant, in this case, the neurologist, to obtain these documents through a secondary source. This policy ensures that the accreditation process remains thorough and adheres to its standards, emphasizing the importance of comprehensive documentation in the credentialing process. Scenario number 5. A newly appointed cardiologist joins a healthcare institution and is in their initial 3-month probationary period with temporary privileges. A senior cardiologist is assigned to evaluate the new cardiologist's performance. What is the correct procedure for evaluating the new cardiologist's temporary privileges according to the institution's policy? A. The senior cardiologist will observe the new cardiologist for a month and then provide a verbal report to the Credentials and Privilege Committee. B. The senior cardiologist must review at least 10 medical records of patients treated by the new cardiologist, including observation of procedures performed. C. The new cardiologist will self-assess their competency and submit a report to the medical director. D. The department head will directly assess the new cardiologist's performance without reviewing specific patient cases. Correct answer. B. The evaluation process for a new healthcare practitioner granted temporary privileges involves a comprehensive assessment by a senior practitioner of the same specialty. This evaluation includes reviewing at least 10 medical records of patients treated by the new practitioner and direct observation of procedures performed. This thorough and objective method ensures a reliable assessment of the new practitioner's clinical skills and decision-making capabilities, essential for maintaining high standards of patient care in the healthcare institution. Scenario number 6. During a night shift, a general practitioner at a hospital encounters a patient with a life-threatening cardiac condition, but no cardiologists are available. What action should the general practitioner take in this emergency situation according to the institution's policy? A. Immediately perform the necessary cardiac intervention using emergency privileges. B. Wait for a cardiologist to arrive while providing basic life support. C. Transfer the patient to another hospital where a cardiologist is available. B. Contact the medical director to request temporary emergency privileges for a cardiologist. Correct answer. A. In life-threatening situations where immediate medical intervention is crucial and a specialist is not available, the general practitioner is empowered to act under emergency privileges. This policy allows any healthcare practitioner, regardless of their clinical privileges, to take necessary actions to save a patient's life or prevent severe harm. It ensures that patient care is not delayed in critical situations, prioritizing patient safety and immediate medical needs. Scenario number 7. Following a massive earthquake causing numerous casualties, a local hospital is overwhelmed with patients and a disaster situation is declared. How should disaster privileges be managed for independent licensed practitioners in this situation? A. All independent licensed practitioners can immediately start treating patients without any formal authorization. B. Disaster privileges must be authorized by the medical director or their delegate before any patient care is provided. C. Independent licensed practitioners are not allowed to treat patients until verified by the Credentials and Privilege Committee. The practitioners must wait for the National Health Services approval before starting treatment. Correct answer. B. In a declared disaster situation, the policy mandates that disaster privileges for independent licensed practitioners must be authorized by the medical director or their delegate. This ensures that qualified practitioners manage patient care, maintaining the quality of medical care even in chaotic and challenging circumstances. The process allows for rapid response to increased patient care demands while upholding medical standards. Scenario number 8. A neurologist who recently completed a 3-month probationary period at a hospital applies for permanent privileges. What is the criterion for granting the neurologist permanent privileges according to the hospital's policy? A. Automatic upgrade to permanent privileges after completing the probationary period. B. Successful completion of the probationary period and a positive review from the Credentials and Privilege Committee. C. Permanent privileges are granted based solely on seniority and years of service in the hospital. D. Approval from the medical director based on a general assessment of performance. Correct answer. B. To obtain permanent privileges, the neurologist must successfully complete the probationary period and undergo a competency assessment and credential verification by the Credentials and Privilege Committee. This process ensures that only qualified and competent practitioners are granted permanent privileges, essential for maintaining high standards of patient care and safety in the healthcare institution. It reflects a commitment to professional excellence and patient welfare. Thank you for joining us. Stay tuned for more policy reviews.